What is STD? STD is defined as sexually transmitted diseases, and they are spread through various ways. STD is spread when you have oral, vaginal, and or anal sex with someone who is infected. Also when you have more than one sex partner or have sex with someone who has had many partners. Also when you don't use a condom while having sex. STD is also spread by direct skin-to-skin contact with the mouth, anus, or genitals. Also by sharing needles or syringes for drug use. This graph shows the estimated total STD infections. Over 110 million people in the US are infected with STDs, and 400 million people worldwide. 19 million new infections are thought to occur each year. So how do you prevent STDs? Sexual abstinence, reduce the number of sexual partners, use condoms correctly, and have a yearly pelvic exam. So what are the type of STDs?
HIV attacks the body's immune system, specifically T cells, which help the immune system fight infections. HIV is spread only in certain body fluids from a person infected with HIV. These fluids are blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk.
In the last year, there has been an increase in STD cases, which has disproportionately affected people from ages 15 to 24. The CDC reported for 1.5 million people have chlamydia, almost 400,000 gonorrhea cases, and 24,000 syphilis cases. Well, how can this be improved? Through primary care. For example, by promoting safer sexual behavior such as use of condoms, by providing STD clinical care that will teach about primary prevention, by spreading STD-oriented prevention messages. What about people who already have STDs? Well, in that case, we would use secondary prevention. Access to services. The public sector includes places such as the family planning clinics. The private sector includes first-level healthcare and care in various specialties. When seeking treatment, avoid traditional healers and unqualified medical practitioners.
So how to provide efficient STD care? Here are some guidelines. Correct diagnosis must be made and effective treatment must be provided. Work must be done in order to reduce future risky behaviors. Advices on treatment must be provided, and also condoms should be promoted and provided. The World Health Organization recommends the syndromic diagnosis and treatment of STDs. Syndromic case management is based on classifying the main responsible agents, giving rise to a particular syndrome, such as the syndrome of urethral discharge in men. Flowcharts are then used, and they help health providers to reach a diagnosis and decide on treatment. The treatment should cover all the important causes of the syndrome. And here are some additional recommendations in order to make treatment more efficient. Focus on training of healthcare providers should be stressed. Also, availability of the means for consultation and examination should improve. In addition, medicine should be consistently available and a steady supply of condoms should be maintained. Thank you for watching.
created using Powtoon.